So actually established that for abscess, we said that another basis of classification of abscess could be like depending on the extent. Okay, so we said that one of another classification of abscess was based on the causative, what is causing it. All right, another one was the extent. Is the abscess deep or is it just on the surface? That's what superficial. All right, so on that basis, let's look at the superficial abscess, which is what we have here. So you could just have like a collection of pores, which is just subcutaneous, which is just beneath the skin. Okay, so this one is a superficial type. Okay, so we say that the superficial abscess is a collection of pores just beneath the skin, typically within the subcutaneous tissue. Right, so here are some things you should note about this characteristics. Yeah, can you see the area is red? There's a swelling, right? So there's redness, there's swelling, and if you feel the temperature around that place, it will be warmer. All right. There will be pain and tenderness. There will be a pus-filled cavity or pockets. All right. There will be crusting or scabbing. All right. And it may drain or rupture, right, because it's closer to the skin. So once the covering is just has a problem, it just ruptures out. Okay, then talking about the causes, you could have things like bacterial infections causing it, like Staphylococcus aureus, Streptococcus pyogenes. It could be due to skin irritation or trauma. It could be due to infected hair follicles, that's folliculitis. It could be due to what? Infected sweat glands, that's what? Hydradenitis. Okay, that's a good concept. I would like to do much research on that. Then treatment. It is just on the superficial side. Okay, it's just close to the skin. So you might just want to do some warm compress to encourage drainage. Okay, to hasten up the drainage. You incise and drain, which is usually done by healthcare professional. Then you can also do antibiotics, topical or oral. Okay, then you can also do pain management, that's analgesics. All right, then you can also do some good hygiene and wound care. All right, do good hygiene and wound care. Then complications, it could lead to things like what? Spread of infection to the surrounding tissues, that's cellulitis. It could lead to abscess reoccurrence. The abscess can be coming back over and over again, even after you treated it and all that. It could lead to scarring. It could lead to what? Lymphangitis. That's what? Infection of lymphatic vessels. It could lead to bacteremia. That's bacteria in bloodstream. All right. So how can you be able to prevent this condition from occurring? Prevention of superficial abscess. Practice a good hygiene. All right, because your health is kind of like uh, a priority in this. Then avoid sharing your personal care items. All right, I use shaving sticks. I don't give you. Okay. All right. Then keep your skin dry and clean. Avoid wearing tight clothes. Then if you have any underlying chronic condition, you try to manage it. All right. So that's it about superficial abscess. Definition, characteristics, causes, treatment, complications, and all that. All right. So there.